A repeal of the Affordable Care Act is coming. President Donald Trump signed an executive order to start scaling it back his first day in office. Good evening. I'm Kim Chapman.
And I'm Joshua. We wanted to learn what is the impact Tennessee hospitals are seeing from the ACA. Alana LaFleur shows us what experts anticipate happening after the repeal. Alana.
Josh, Kim, today I talked to the president of the Tennessee Hospital Association. That's a group that advocates for hospitals, patients, and healthcare systems. According to the Tennessee Hospital Association, 200,000 people in Tennessee have insurance because of the Affordable Care Act. The not-for-profit group that advocates for member hospitals and health systems says financially, that's helped the industry.
Certainly, if they were to lose it, that would have a dramatic impact on the uncompensated care that hospitals like Erlanger provide to the people of Chattanooga.
More people with insurance covering their care and paying for their hospital bills is why Craig Becker, president of the Tennessee Hospital Association, says the act has been positive for hospitals. But it's also been expensive. According to the Annenberg Public Policy Center's factcheck.org, the Congressional Budget Office estimates the ACA net cost insurance coverage would be $1.35 trillion from 2016 through 2025. Becker has other issues with the act, despite his belief it's benefiting hospitals.
The worst in this case would be those regulations that are really overbearing.
Becker says those regulations are on the business end. He says the required reporting and methods of payment from the state is too detailed.
It impacts the patient. It does impact them because they have to fill out a lot of paperwork. They have to deal with the bureaucracy as much as we do, and we just don't think that's right.
While the repeal of the ACA is in the works, there's no word yet from the new administration on what exactly will replace it. Chad Henderson lives in North Georgia. He'll start a new job this spring, but for now, he depends on the Affordable Care Act for coverage.
It's mostly a security thing. I haven't had to use it that much, but knowing that it's there, if something were to happen, it gives you a sense of security.
While he mostly supports the ACA, he wants to see things improve under the repeal.
I'm up for going to a single-payer system. I've been in favor for that. I think that we should have included a public option.
The president of the Tennessee Hospital Association says whatever happens after the repeal, he wants to see a more affordable option without high deductibles and premiums. Josh.
Alana, thank you. The Washington Post reports that several GOP D.C. lawmakers were recorded talking about the issue of replacing the Affordable Care Act at the Republican retreat in Philadelphia this week. One of those lawmakers was Senator Lamar Alexander. His words, according to the Post, were that the replacement should be, quote, not a quick fix. We want a long-term solution that lowers costs. Post also says that the remarks of all lawmakers were confirmed by their offices or by the lawmakers themselves.